I am about to show you the specific nutrients that help relax stiffening arteries in older adults. I have seen too many patients over 60 doing everything right with their diet, cutting salt, eating more vegetables, yet their numbers remain stubbornly high because they are missing a key internal building block. It often starts with that subtle feeling of pressure behind the eyes in the late afternoon or waking up with a dull headache that just won't go away. These are signs your doctor might have missed while focusing only on prescriptions. I'm Dr. Ben Harris, and today I am going to walk you through the 4 specific supplements that have helped my patients regain control of their blood pressure naturally. The first essential nutrient is magnesium, but specifically a form that absorbs into the tissues rather than just passing through the digestion. This is the foundation of blood pressure management, because magnesium is what allows the smooth muscles inside your artery walls to physically relax. Imagine your blood vessels are like a garden hose. If you are pinching the hose, the pressure builds up behind the pinch. Magnesium is the signal that tells the hand to let go, widening the hose and lowering the pressure. However, most seniors are taking the wrong kind, and this is where the confusion usually starts. I want to share the story of a patient named Arthur. Arthur was 72 years old when he came to see me. He was a retired engineer, very detail-oriented, and he was frustrated. He told me he was doing everything his cardiologist suggested, but his top number, his systolic pressure, would spike unpredictably in the evenings. He also suffered from terrible leg cramps at night, which is often a classic sign of mineral imbalance. Arthur told me, "I'm already taking magnesium, Dr. Ben. I take it every morning." When I asked him to bring in his bottle, it was magnesium oxide. This is the most common form sold in drugstores because it is cheap to manufacture, but it is very poorly absorbed by the body. For an older adult, magnesium oxide often acts more like a laxative than a blood pressure aid. It stays in the gut, causing loose stools, and very little of it actually makes it into the bloodstream to relax those stiff arteries. Arthur was trying to do the right thing, but the tool he was using wasn't sharp enough for the job. We made a simple switch. I recommended he change to magnesium glycinate. This form is bound to glycine, an amino acid that has a calming effect and helps the magnesium pass through the intestinal wall much more efficiently. But there was another mistake Arthur was making, and this is critical for you to know before you even start a supplement routine. It wasn't just about what he was swallowing, it was about how he was measuring his progress. When Arthur showed me his logbook, his numbers were all over the place. I asked him to show me exactly how he measured his blood pressure at home. He sat down, pulled out his machine, and wrapped the cuff right over his thick wool sweater. This is one of the most common errors I see. Placing the cuff over clothing can add anywhere from 5 to 50 points to your reading, depending on the thickness of the fabric. To get an accurate baseline, you must place the cuff on bare skin. You need to sit quietly for 5 minutes before you push the button. No talking, no television, and feet flat on the floor. If you are talking while the machine is running, simply speaking can raise your pressure by 10 to 15 points. We corrected Arthur's measurement technique first. Then we started him on the magnesium glycinate in the evening. The improvement didn't happen overnight, but it was steady. After about 3 weeks, Arthur noticed 2 things. First, the leg cramps disappeared, which told us his tissue levels were rising. Second, those unpredictable evening spikes began to smooth out. His arteries were finally getting the signal to relax. For most older adults, the goal is to find a magnesium that is gentle on the stomach. If you struggle with sleep issues along with high blood pressure, magnesium glycinate is usually the preferred choice. It helps calm the nervous system and prepares the body for rest. There is another form called magnesium taurate. This is bound to taurine, which has a specific affinity for the heart muscle. If you have a history of heart palpitations or arrhythmias along with high blood pressure, this might be a variation to discuss with your healthcare provider. The dosage varies for everyone, but generally, we look for a total elemental magnesium intake that supports your body weight and activity level. It is very difficult to get enough from modern food because our soil has been depleted of minerals over the last 50 years. Even if you eat plenty of spinach and almonds, you might still fall short. When you look for this supplement, turn the bottle around and look at the supplement facts panel. You want to see the words magnesium glycinate or magnesium bisglycinate. If it says magnesium oxide or magnesium citrate, put it back on the shelf if your primary goal is blood pressure control without digestive upset. Taking it in the evening is often best because our blood pressure naturally dips at night, or at least it should. Taking magnesium an hour before bed can support this natural dipping phenomenon, allowing your cardiovascular system to get the deep rest it needs. Before we move on to the next nutrient, I want to know where you are starting from. Comment your age and your usual top number range below. Are you in the 130s, the 140s? Seeing where others are can help you realize you are not alone in this journey. The second supplement is coenzyme Q10, often written as CoQ10. This is the spark plug for your cells. Every single cell in your body has a tiny engine inside it called the mitochondria. These engines need fuel to produce energy, and that fuel is CoQ10. Your heart is the hardest working muscle in your body. It beats 100,000 times a day, never resting, never stopping. Because it works so hard, it requires a massive amount of energy. When your heart muscle has enough energy, it pumps efficiently. When it lacks energy, it has to strain. That strain can contribute to higher pressure. Here is the problem for older adults. Our natural production of CoQ10 drops significantly as we age. By the time you are 60, your heart has much less of this vital nutrient than it did when you were 20. But there is a second factor that makes this even more critical for many of you. I want to tell you about Margaret. Margaret was 68, a retired school teacher who loved to garden. She came to me because she was feeling constantly fatigued. She described it as walking through mud. Her legs felt heavy, and her brain felt foggy. Her blood pressure was erratic. Sometimes it was low, sometimes it was very high. She was taking a statin medication to lower her cholesterol, which her previous doctor had prescribed a few years prior. What no one had told Margaret is that statin medications, while effective at lowering cholesterol, also block the body's production of CoQ10. They use the same biological pathway. So, while she was treating one cardiovascular risk, she was inadvertently depleting the fuel her heart needed to function properly. We see this often. The fatigue she was feeling was a classic sign of mitochondrial depletion. Her heart was literally running on fumes. Now, I want to be clear, I did not take her off her medication. That is a decision for her and her prescribing physician. However, we needed to replenish what was being lost. We introduced a CoQ10 supplement, but again, the type matters immensely. There are two forms of CoQ10 on the market. One is called ubiquinone, and the other is called ubiquinol. Ubiquinone is the oxidized form. It is the cheaper version you see in most bulk discount stores. For your body to use it, it has to convert it into the active form. When you are young, your body does this conversion easily. But as we age, specifically over the age of 50 or 60, our ability to convert ubiquinone into ubiquinol decreases. Margaret was taking a cheap ubiquinone supplement she found on sale, but her body wasn't able to process it efficiently. It was like putting diesel fuel into a car that needs premium unleaded. We switched her to ubiquinol. This is the active, antioxidant form that is ready for your body to use immediately. A recent meta-analysis of clinical trials has shown that CoQ10 supplementation can have a significant effect on systolic blood pressure, that top number, in older adults with metabolic issues. The science suggests that by improving the bioenergetics of the vessel wall, we help the vessels dilate more easily. For Margaret, the change took about 4 to 6 weeks. The first thing she noticed was her energy returned. She could work in her garden for an hour without feeling like she needed a nap immediately after. Then, her blood pressure readings began to stabilize. The erratic spikes became less frequent. Her heart had the energy it needed to pump smoothly, without the desperate straining that drives up pressure. If you are over 60, and especially if you are taking any medication that impacts cholesterol, checking your CoQ10 status is a smart conversation to have. When you look for this, look for the word ubiquinol on the label. It is often more expensive than the standard version, but because the absorption is so much better, you are actually getting more value for your money. You want to take this supplement with a meal that contains some fat. CoQ10 is fat-soluble, meaning it dissolves in fat, not water. If you take it with just a glass of water on an empty stomach, you might absorb very little of it. Taking it with your breakfast eggs or with dinner, if that's your largest meal, ensures your body can uptake the nutrient. Margaret's story is a reminder that sometimes high blood pressure isn't just about the vessels being tight, it's about the heart lacking the energy to do its job with ease. If you are finding these tips helpful, please subscribe to the channel. I share these practical, senior-focused health strategies every week to help you navigate your health with confidence. The third supplement is aged garlic extract. Notice I did not just say garlic. This distinction is very important. We have known for centuries that garlic is good for the heart. Ancient civilizations used it for strength and endurance. But for the specific purpose of lowering blood pressure in older adults, simply eating raw garlic might not be enough. And for many, it comes with unpleasant side effects. The issue with aging arteries is stiffness. As we get older, our blood vessels lose their elasticity. They become like old rubber pipes, rigid and hard to expand. When the heart pumps blood into a stiff pipe, the pressure shoots up. This is often why we see isolated systolic hypertension in seniors, where the top number is high, but the bottom number is normal or low. Aged garlic extract has been shown in studies to help improve this arterial elasticity. It helps the arteries act younger. Let me tell you about Robert. Robert was 75 and he fit this profile perfectly. His top number was consistently around 150, but his bottom number was 70. His doctor told him he had stiff arteries. Robert had read online that garlic was the cure, so he started eating 2 cloves of raw garlic every morning. The result? He had terrible heartburn. He smelled like garlic constantly, which made him self-conscious at his bridge club. And worst of all, his blood pressure didn't budge much. The stress of the indigestion was probably keeping it high. Robert was making the mistake of thinking that natural means raw. But in the case of garlic, the magic happens during the aging process. Aged garlic extract is made by slicing garlic and storing it in ethanol for up to 20 months. During this time, the harsh, unstable compounds in raw garlic, the ones that cause the smell and the heartburn, are converted into stable, potent compounds, specifically one called S-allylcysteine. This compound, S-allylcysteine, is highly bioavailable. It enters the bloodstream and increases the production of nitric oxide. Nitric oxide is a gas produced by the lining of your blood vessels. It is the body's most powerful vasodilator. It tells the vessel walls to open up. When we switched Robert to a high-quality aged garlic extract, his stomach issues vanished immediately. He could take the supplement without any burning sensation or social embarrassment. Over the course of 3 months, we saw a gradual decline in his systolic pressure. It wasn't a crash, it was a gentle, sustained reduction. His arteries were becoming slightly more compliant. The pipe was becoming less rigid. Robert was diligent. He took the extract twice a day with food. He combined this with a specific breathing technique I taught him, slow, deep breaths for 5 minutes twice a day, and the combination was powerful. If you are considering aged garlic extract, you need to look for that specific phrasing on the bottle. Garlic oil or garlic powder is not the same thing. You want the clinically studied aged garlic extract. There is a safety note here that we must address. Garlic naturally thins the blood slightly. It prevents platelets from clumping together. This is generally good for heart health as it reduces the risk of clots. However, if you are already taking a prescription blood thinner, such as warfarin or Eliquis, adding a high dose of garlic extract could increase your risk of bleeding. This is a situation where you absolutely must consult your doctor before adding this to your regimen. For Robert, who was not on blood thinners, it was a safe and effective lever to pull. It addressed the root cause of his high pressure, the stiffness of the vessel walls. It is remarkable how something as simple as a plant extract, when prepared correctly, can have such a profound impact on our physiology. We have covered the vessel relaxer, the cellular spark, and the artery softener. But there is a fourth component that acts as the traffic director for calcium in your body. Without this next nutrient, the calcium you eat might end up in your arteries instead of your bones, making your blood pressure worse. This next point is perhaps the most critical for preventing the hardening of the arteries that plague so many people over 60. If you are enjoying this breakdown, please take a moment to subscribe. It helps me continue to bring you this research-backed, senior-friendly information. Let's move on to the fourth supplement, which is actually a dynamic duo that must be taken together. The fourth item is actually a combination of vitamin D3 and vitamin K2. I group these together because, in nature and in your body, they work in a partnership. Taking one without the other can sometimes lead to problems, especially for older adults concerned about blood pressure. Here is the situation. Many seniors are told to take calcium and vitamin D for their bones. We worry about osteoporosis and fractures, so we load up on calcium supplements. But here is the question. Once that calcium gets into your blood, where does it go? Vitamin D is like the gatekeeper. It helps your body absorb calcium from your food or supplements and gets it into the bloodstream. It opens the door. But vitamin D does not tell the calcium where to go once it is inside. That is the job of vitamin K2. Vitamin K2 is like the traffic cop. It directs the calcium into the bones and teeth where it belongs. Crucially, it also activates a protein that sweeps calcium out of the soft tissues, like your arteries and your kidneys. If you have high levels of calcium and vitamin D but low levels of vitamin K2, that calcium can settle in the walls of your arteries. This is called calcification. It turns soft, flexible blood vessels into hard, brittle pipes. And as we discussed with Robert, hard pipes mean higher blood pressure. I want to share the story of Susan. Susan was 70 years old. She was very health conscious and had been taking high doses of vitamin D and calcium for over a decade because her mother had suffered a hip fracture. She wanted to protect her bones. However, her blood pressure had been creeping up steadily, year after year. Her doctor noted that her arteries seemed stiff. When we looked at her supplement routine, she was taking 5,000 IU of vitamin D3 daily and a large calcium carbonate pill, but zero vitamin K2. Essentially, she was flooding her system with calcium, but she had no traffic cop to direct it. It is possible that some of that calcium was contributing to the stiffening of her arterial walls. We adjusted her regimen. We didn't stop the vitamin D, because vitamin D is essential for blood pressure regulation too. Low vitamin D is linked to hypertension, but we added vitamin K2, specifically the form known as MK7. MK7 is the long-acting form of vitamin K2. It stays in the blood longer, allowing it to do its job of directing calcium more effectively. We also made a change to her lifestyle that acted as a same-day lever. I asked Susan to start getting outside for a 15-minute walk every morning. This did two things. First, the natural sunlight helped her body regulate its own vitamin D production, which is always superior to supplements. Second, the rhythmic movement of walking helps flush stress hormones like cortisol that keep blood pressure high. Susan's blood pressure didn't drop overnight. Calcification is a slow process, and reversing or halting it is also a long-term strategy. But over the next 6 months, her numbers stopped climbing. They stabilized. And interestingly, her bone density scans at her next checkup showed improvement. By adding K2, we made sure the calcium was going to the bone, strengthening her skeleton while keeping it out of her arteries, protecting her blood pressure. This is why, if you buy a vitamin D supplement, I always recommend looking for one that already includes K2 in the capsule. It takes the guesswork out of the ratio. If you are taking blood thinners, specifically warfarin, Coumadin, you have to be very careful with vitamin K. Warfarin works by blocking vitamin K. If you add vitamin K back in, you can make the medication less effective. This is a strict ask your doctor situation. However, newer blood thinners often do not have this same interaction. For the general senior population not on warfarin, adding K2 is one of the smartest moves you can make for both bone and heart health. This concept of the traffic cop is something few people talk about, but it is vital for longevity. We have now established a strong foundation: magnesium to relax the vessel, CoQ10 to power the pump, aged garlic to soften the pipe, and D3 plus K2 to keep the pipe free of calcium buildup. But there is another factor, something that deals with the silent killer inside the vessels: inflammation. The fifth item is omega-3 fatty acids. You have likely heard of fish oil. It is one of the most popular supplements in the world, but for blood pressure, the quality and the dose are what separate success from failure. Inflammation is like a fire inside your artery walls. When the lining of your blood vessels is inflamed, it swells. This swelling narrows the channel for the blood to flow through. It also makes the vessel wall sticky, which attracts plaque. Omega-3 fatty acids are the body's fire extinguisher. They help cool down this inflammation, keeping the lining of the blood vessels smooth and slippery. Let me tell you about James. James was 65, a truck driver who had spent years eating on the road. His diet was high in processed foods, fried foods, and vegetable oils like soybean and corn oil. These oils are high in omega-6 fatty acids, which, in excess, promote inflammation. James's blood pressure was high, and his blood work showed high markers of inflammation. He felt stiff and achy in his joints, which is often a mirror of what is happening inside the arteries. James hated fish. He just couldn't stomach the taste or the smell, so he wasn't getting any omega-3s from his diet. We started James on a high-quality omega-3 supplement, but we had to be specific. Many fish oil capsules are filled with low-quality oil that has gone rancid. If you bite into a fish oil capsule and it tastes incredibly fishy or sour, it might be oxidized. Consuming oxidized oil is counterproductive. It adds inflammation rather than reducing it. We looked for a supplement that was high in EPA and DHA. These are the two active ingredients. EPA is particularly good for heart health and inflammation. I told James to put his fish oil capsules in the freezer. This is a little trick. It helps keep the oil fresh, and it also prevents the fish burps that many people dislike. We also worked on a long-term lever for James. Since he wouldn't eat fish, we looked at other ways to reduce the inflammatory oils in his diet. He started swapping his bag of chips for a handful of walnuts, which are a plant-based source of omega-3s. After 2 months, James's joint pain improved significantly. He could climb into his truck cab without groaning. This was the external sign that the internal fire was cooling down. His blood pressure readings began to trend downward. The omega-3s were making his blood slightly less viscous, less thick, which makes it easier for the heart to push it through the system. For older adults, aiming for about 1,000 to 2,000 milligrams of combined EPA and DHA per day is often the therapeutic range recommended for heart protection. If you are vegan or allergic to fish, you can get these same benefits from algae oil. In fact, fish get their omega-3s by eating algae. By taking algae oil, you are just going straight to the source. James's success came from consistency. He took his frozen fish pills every day with lunch. It became a habit that protected his heart and lowered his pressure. Now, this next item is a bit different. It is technically a supplement, but many people enjoy it as a tea. However, its effects on blood pressure are so well documented that it rivals some medications. The final item on our list is hibiscus tea, or hibiscus extract. This beautiful red flower is more than just a refreshing drink. In clinical studies, hibiscus has been shown to act as a natural ACE inhibitor. ACE inhibitors are a class of blood pressure medications, like lisinopril, that work by blocking an enzyme in the body that causes blood vessels to constrict. Hibiscus contains anthocyanins that do this naturally, though more gently. I want to introduce you to Linda. Linda was 69 and very sensitive to medications. Every time her doctor tried to start her on a low-dose pill, she got dizzy or developed a dry cough. She really wanted to try a natural route first. Her blood pressure was consistently in the 140s-90s, not dangerously high, but high enough to be a concern for stroke risk over time. I suggested Linda try hibiscus. She decided to use the tea form because she enjoyed the ritual of it. But here is the key. You cannot just dip the tea bag for 30 seconds and expect a medical result. You need to extract the compounds. Linda's routine was to brew a strong pot of hibiscus tea every morning. She used dried hibiscus flowers, about a tablespoon, and let them steep in hot water for a full 10 minutes. She covered the cup so the volatile oils wouldn't escape. She drank 2 to 3 cups a day. It is tart, like cranberry juice, so she added a little stevia to sweeten it without spiking her blood sugar. We tracked her numbers. For the first 2 weeks, nothing happened. She was disappointed. But I encouraged her to keep going, as plants often work slower than pills. By week 4, we saw the shift. Her morning numbers dropped into the 130s. By week 6, she was occasionally seeing high 120s. She felt great. She was hydrated, she was enjoying a calming ritual, and she was actively lowering her blood pressure with every sip. If you don't like tea, you can find hibiscus extract in capsule form. You would look for a standardized extract to ensure you are getting the active compounds. Linda had to be careful with one thing. Hibiscus is a diuretic. It makes you urinate more, which helps lower blood pressure by removing excess fluid and sodium. Because of this, she had to make sure she was drinking enough plain water too, so she didn't get dehydrated. Comment yes below if you are a tea drinker, or no if you prefer coffee. I am curious to see how many of you might already be able to incorporate this into your day. Conclusion. So, we have a powerful toolkit here. We have magnesium to relax the vessel wall. We have CoQ10 to give the heart the energy to pump. We have aged garlic extract to improve the flexibility of the arteries. We have vitamin D3 and K2 to direct calcium away from the arteries and into the bones. We have omega-3s to cool inflammation and thin the blood. And we have hibiscus to act as a natural relaxant for the system. You do not necessarily need to take all of these. In fact, starting with 1 or 2 that resonate with your specific symptoms is often the best approach. If you have leg cramps, start with magnesium. If you are tired and on statins, look at CoQ10. If you have stiff arteries, investigate aged garlic or K2. Always remember that supplements are there to supplement a healthy lifestyle. They work best when you are also moving your body, eating whole foods, and managing your stress. And please, if you are on any prescription medications, print out this list and show it to your doctor or pharmacist. They can help you check for any specific interactions with your unique medical history. I'm Dr. Ben Harris. My goal is to help you live a longer, stronger, and healthier life. If you know someone over 50 who could benefit from this, share this video. And subscribe for more simple blood pressure and blood sugar tips. I will see you in the next video.